I loved making this issue. I've got to tell you, talking with Ira Glovinsky, what an amazing guy. So he's, for many, many years as a psychologist, looked at how people are kind of regulated and not regulated. And when they're not, how they kind of misbehave. And how do you interpret misbehavior in a way that helps you understand what's really creating it? Also in this issue, I did a piece with Paula Jersek. How do you know when you're talking with a family and a child, what level of arousal the child is expressing? And in this issue, we kind of go through what's the difference between being calm and reflective versus being alert in everyday life, and then moving on to states of alarm, and then fear, and then terror. In this issue, we go after a major clinical conundrum. What do we do about benzodiazepines? So many people prescribe them for kids, and what about the risk? What about the benefits? Are there actually benefits? The things that we run into with those are so problematic. We have so many adults and, by extension, a lot of kids who are kind of stuck on benzos. Well, in this issue, we grapple with the problem of benzodiazepines. This is a double issue, and we've got a lot of content, but I also want to draw your attention to the desvenlafaxine research that's come up recently. I think that we've all paid some attention to the fruits of transparency brought about by all trials and the new regulations at the FDA. And here we're finally seeing that under threat of penalties, financial penalties for suppressing negative data, we've got journals who are reporting negative trials. And now we are turning a page in the history of psychopharmacology with these transparency laws.